In terms of, estimates of how high this could go, I don't know if anyone knows the answer to that.
Columbus Public Health is asking the Centers of Disease Control and Prevention for help because there are now 24 confirmed measles cases here in Central Ohio.
All of these cases are children. So far, 9 have needed hospital treatment. The virus has been tracked back to 9 daycare centers and 2 schools. NBC4's Caleb Michael talked to CPH and Columbus City Schools about what steps will be taken if there is an outbreak within the district. Caleb?
Jared, CCS says they have protocols in place in the event someone presents the symptoms of the measles. Those could be a blotchy skin-like rash or flu-like symptoms. Doctors say right now the most at-risk group are those that are unvaccinated.
Measles is highly contagious. It's a very transmissible disease.
6 new cases of the measles have been reported in Franklin County as of Thursday.
It's definitely an emergency for anyone who's not vaccinated.
Dr. Mashika Roberts with Columbus Public Health says they are working to figure out the case of origin.
We are actively doing case finding and trying to figure out where the connection is. I can tell you that we have asked for assistance from the federal government, specifically the CDC.
The measles has now been detected in 2 schools. The question for many is, what plans do those schools have in place?
We have a protocol to quickly isolate them, contact the families, contact the Columbus Public Health Department, because we partner with them very closely to really get that child an appointment to get a medical evaluation and tested so we know what's going on.
Dr. Sarah Bodie is the medical consultant for Columbus City Schools. She says it is a requirement for students to be vaccinated by the time they start kindergarten.
The thing about the measles vaccine that's amazing is it is highly protective against measles. So unlike some other vaccines where you still can contract, a virus pretty easily.
But there are exceptions.
In the state of Ohio, we do have a system where families can, for various reasons, opt out of vaccines. And so we do know that, though. We track the vaccination status of all of our students.
She says the majority of students in CCS have their MMR vaccine, which helps their course of action if there is a confirmed case.
We would work with the public health department to determine, the level of exposure and what we need to do. But most of the time, that's going to be students who are unvaccinated that would need to be isolated.
Doctors also have this message for parents.
There's clear guidance from the CDC that if there is a community outbreak of measles, a child under the age of 12 months can get the vaccine earlier.
CPH says they are working with the CDC to determine the case of origin. They should be coming to town here very soon. Doctors are continuing to reiterate that the MMR vaccine is both safe and very effective. Local for you in Columbus, I'm Caleb Michael, NBC4.